The public has such great fascination with liposuction. We've all heard jokes about liposuction and everybody getting skinny by liposuction. The reality is that while liposuction is fantastic, while liposuction is the second most frequently done of all plastic surgery procedures, it can't make the fat people thin, and it can't give people six-pack abdomens that don't work out hard and aren't super skinny. What does liposuction do? Liposuction removes areas of fat that create abnormal bulges, areas of disproportion, of lack of good harmony, so that it can make somebody have a body that's much more proportional and attractive. How does someone decide if liposuction is right for them? The answer is they should look at themselves alone in the mirror. And anybody can figure out to themselves that their chin is disproportionate to their chest, to their waist, to their stomach, inner thigh, outer thigh. Look for whether or not you have a bulge relative to the surrounding areas, and whether one area doesn't match another area. Frequently, women will say to me, oh, I go to buy a suit, it fits me in the waist, but it doesn't fit me in the outer thighs. That's the starting point for liposuction. If you're generally heavy in all of these areas, and there's one area that really leaps out, then the sad reality is that's something that really is more amenable to weight loss than liposuction. There are many different techniques to do liposuction. You see a lot on the internet about laser lipo, ultrasonic lipo, power lipo, smart lipo. The bottom line is the technique is far less important than the person that's doing it. You can find excellent surgeons doing every one of these techniques, and you can find poor surgeons using every one of these techniques. So it's the most important thing to find someone who's skilled not just technically, but also in analyzing your body, and who has an artistic sense and an aesthetic eye to determine what it will take to create the optimum balance for your body. The most frequent question patients ask about liposuction is, well, if you do liposuction in one area, won't the fat go somewhere else? And the answer is no. It doesn't if the liposuction is done in the right indication. This is what I mean. If somebody is generally overweight, and they have a big chest, a big chin, and a big stomach, and let's say you only did liposuction on their stomach, and you made their stomach really thin, but then they continue to eat more each day than they burn, their body needs to store that fat. So that fat's been removed from their stomach, so they will now store the fat disproportionately somewhere else. So the way to avoid that is just not to do liposuction on somebody where the primary problem is that they're overweight and continuing to gain weight. The prime to do liposuction is where there's 1, 2, or even 3 or 4 disproportionate areas relative to the rest of the body. Certainly when someone's thin, because it's easy to tell in a thin person if they have big love handles or big outer thighs, but even someone who's a little bit heavy where there's one area that's disproportionate to the other. So the end goal of liposuction is to create a beautiful and proportionate harmony in the patient's body so that whether they lose or gain a little bit of weight, they should still maintain that beautiful balance. Patients are thrilled with the results from liposuction most often. The only drawback I've seen after looking at this for many, many years are 2 things. One is that some patients still in their mind envision becoming much thinner than is really reasonable or practical to attain for them with their body. And the way to avoid that is just by talking to the patient ahead of time, looking at photos, and being reasonable about what the outcome can be. The second is the effect of their skin tightening after the procedure. See, plastic surgeons have very little control over the extent of skin tightening. Different liposuction techniques may or may not have a variable ability to tighten the skin, but at the end, it's a biological process that we don't have a lot of control over. A thin woman with good, thick, tight skin who's only having a little bit of fat removed, that's going to shrink down perfectly tight. A very overweight person with thin, stretch-marked, or sun-damaged skin, that skin's not going to tighten down as much. So the most important thing any person needs to do after deciding what parts of their body they might want to have liposuction on is to have an honest assessment of their skin quality there to try to know what to expect they're going to look like after the procedure. But with an excellent surgeon, an excellent surgical plan, and realistic goals specific to that patient's body, patients can be extremely satisfied and thrilled with the result of liposuction.